Hi class, today I want to talk to you about our upcoming technique competency in clinic on universal curettes, and I want to give you some pointers to help you be successful on that. Okay, so I have today with me the Barnhart 5.6. It looks different from the Barnhart 5.6 that's in your kit. Yours has a resin handle that's red, and then the ends are gold because it's an XP technology, so the metal is sharper. It doesn't need to be sharpened as often, and you use lighter lateral pressure with a shaving stroke. But for your competency, for each of your universal curettes, your Barnhart 1.2, your Barnhart 5.6, and your Columbia 13.14, you're going to be asked to identify the parts of the working end, and you're going to want to do this with a periodontal probe. So I have here the toe third, the middle third, and the heel third, okay? So the working end is the part of the instrument that does all the work. It's made up of a face, a back, and then the lateral sides. The lateral sides are your cutting edges. With a universal curette, both sides are cutting edges, and the face to terminal shank relationship is 90 degrees, okay? And where the working end ends and all the way up to where the shank meets the handle, that is your functional shank. And then the last part, the last section of the shank from the last bend to the working end is called your terminal shank, okay? Remember, we're always watching this terminal shank when we scale. We don't need you to point out all of that on your TC. I just wanted to review that. So on your TC, again, you're just pointing out the three parts of the working end, the toe third, the middle third, and the heel third. For each instrument, we're going to give you an anterior tooth and a posterior tooth because these are universal curettes, which means they can be used both in anterior and posterior. So when we give you a tooth number and surface, we're evaluating that you know your tooth numbers, that you know what clock position you should be in, that you know how to position your patient, and you know how to find the correct working end. So if my instructor said tooth number 8, facial, this would be number 8, the maxillary right central incisor. If I have to do the facial, then I need to do the whole facial, both surfaces towards and away. I'm going to begin with surfaces away because I'm currently sitting at 12 o'clock. So I'm going to find my working end. I'm going to go to the midline of the tooth. If my handle's in line with the long axis, then I can see that my toe is curved outward towards the gingiva, and that is not correct. I'm going to flip my working end. This looks much better. Handle's in line with the long axis of the tooth. Now my toe is wrapping the surface away from me, so I know that is the correct working end. And remember, these can be used supragingivally and subgingival. So we really need to see an intentional angulation of 0 to 40 to close your angle and insert. So I'm going to lean into the tooth to try to get my face as flat as possible. I'm going to slide sub, open up just enough to 60 to 80, and then I secure my fulcrum and I can begin strokes. And I'm doing some vertical strokes, and right here as I get around this line angle, I need to roll to stay adapted, but I don't want to roll and not pivot because then I'm going to be flat on my face just sliding over the tooth. So as I get to right about here at the mesiofacial line angle, I'm going to roll, and I'm also going to pivot so I can bring the whole instrument with me as I get around that line angle. And now I can feel my cutting edge, and I can even hear that I'm on my cutting edge, okay? So now to do the surface towards me. My option is I can stay at 12 o'clock to do the surface towards me, or I can move to 8 to 9 o'clock, which is what I prefer. So I'm gonna move. So now I already know my proper working end would just be the opposite end from what I was using before. I'm gonna lean into the tooth to insert. At 0 to 40, open up, start scaling, I'm rolling, I'm pivoting, bringing that handle with me as I come down. And work it interproximally and then come out. Okay, now if my instructor said, I want you to do tooth number 24 facial, then that would be the mandibular left central incisor. Okay, so I'm gonna do the surface towards me since I'm already sitting at 8 o'clock. Remember, if you're doing surfaces towards you on the mandibular anteriors, you have to move to the side of the patient. And now we're going to try to find the correct working end. Same way we did before. That is incorrect because my toe is pointed out towards the gingiva. Okay, this is my correct working end. Now I'm making sure that I have my modified pen grasp. I'm standing really tall on my fulcrum so my handle is vertical, leaning into the tooth to get to 0 to 40, inserting, opening, and now I'm going to start scaling using some vertical strokes. And here, because this tooth is a lot smaller than number 8, I really need to pivot even a bit more than I was before. So I'm going to roll and pivot. And if I can see that my terminal shank is slightly leaning into the surface I'm scaling as it is, then I know I'm at the correct angulation, and I can also feel my cutting edge. Now to do the surface away, I need to sit at 12 o'clock. So I'm going to move, and I know that the opposite side or working end would be correct. So now I'm ready to position myself. I'm standing tall on my fulcrum. My handle is vertical. I'm leaning in to insert at 0 to 40 and out or away to open up. I'm going to start scaling. I'm rolling. I'm pivoting to stay on my terminal shank. And I can tell that I'm at the right angulation by the position of the terminal shank. Okay. Now, if I were told I needed to go to tooth number 30 and do the buccal. This is tooth number 30, the mandibular right first molar. So I need to be sitting on the side of the patient because that's a posterior surface towards me. So I'm sitting in that orientation already. I could have my patient lower their chin a little bit, and now I need to find the working end. So this would be the correct working end as I insert between the premolars because the bend is to the back. Just to see what the incorrect working end would look like. Bend is not to the back, it's to the front, so that's incorrect. Okay, my sequence on a posterior tooth is always to start at the distal line angle. So I have my toe pointing the direction I'm going in. I'm going to drop my handle to achieve that 0 to 40 degree angulation for insertion. And slide sub. And now I'm going to stand tall on my fulcrum and secure my fulcrum. And now I'm at 60 to 80, and now I can begin scaling. And oops, my tooth is lifting out. Okay, and then I would go back to the distobuccal line angle, lean into the tooth to insert at 0 to 40, always overlapping at that line angle, opening up to 60 to 80. Line angles are excellent areas for horizontal strokes. To do a horizontal stroke, I lower my hand so my handle itself is even horizontal. Then to do an oblique, I stand a little taller. To do oblique strokes, to do vertical, I stand as tall as I can to do vertical strokes. And I'm scaling in channels or zones, utilizing multi-directional strokes. Now I'm coming across that mesial. For the mesials of the mandibular posteriors, it's tricky to get the terminal shank in this position because your handle will hit the maxillary teeth like this. Okay, so one way to avoid that is you can kind of come out buccally slightly and then go back to get to that 60 to 80. Or another alternative, if you're right-handed, then you would move to the other side of the patient, which would be 2 o'clock. For lefties, then that would just be the opposite side of the clock. And you would fulcrum either intraorally on the opposite arch and reach down, or you could fulcrum extraorally on the zygoma and reach down. You would just have to extend your grasp on your handle a little bit higher. But either one is fine. And then you would insert at the mesiobuccal line angle at 0 to 40 and open up slightly, and it already puts you right there at that 60 to 80. Okay, so that's an option. If you choose to do that on your competency, I would just let your instructor know I'm using an alternative technique to move around to 2 o'clock, and then we'll understand what you're doing. Okay, so last area, let's say my instructor says, go to tooth number 21, lingual. Okay, that is the mandibular left first premolar, and that is also a surface towards me. So I'm going to stay on the side of the patient at 8 to 9 o'clock. If this is my correct working end for number 30, I actually know that it's going to be my correct working end on number 21 lingual as well, because the bend is to the back still. So now I'm ready with a intraoral fulcrum. I'm going to lower my handle like this. Notice as I lower my handle, I don't move my fulcrum at all. It stays in the same area. I'm just pivoting on my fulcrum like this, kind of up and down like this. So lower my handle, get my face flat against the tooth, drop sub, open up, stand taller on my fulcrum to 60 to 80, and I can begin scaling. I'm working distally until I get under the contact, going back to the distal lingual line angle, inserting at 0 to 40, dropping sub, opening. And there's some artificial calculus down here. And I'm doing my multi-directional strokes, and then I'm going to stand taller on my fulcrum and pivot so I can maintain 60 to 80 and finish my strokes. Okay, so for every instrument, all 3 universal curettes on your competency, you're going to be given an anterior tooth and a posterior tooth, and just keep practicing at home with your typodont. If you do all these things in the video, I think you're going to be successful. So good luck.